Thank you for joining us for Talking Sleep, a podcast of the American Academy of Sleep Medicine. I'm your host, Dr. Seema Khosla, Medical Director of the North Dakota Center for Sleep in Fargo. Today's episode is sponsored by Axome. The New England Journal of Medicine published a study in 2024 demonstrating the presence of microplastics and nanoplastics in the carotid artery plaque in some patients who then had a 4.5 times higher risk of stroke, heart attack, or death over the following 3 years. That same year, a study was published in JAMA demonstrating the presence of microplastics in the olfactory bulb of the human brain. This raises even more concerns about the ubiquitous use of plastic in our lives, including PAP devices. Our two guests today have done some research into the presence of microplastics in the nasal airway in patients on PAP and those not on PAP. They are here today to discuss the results of their work and to discuss some of the nuances about microplastics and the accompanying inflammatory mediators. Dr. Mauad is an associate professor in the Department of Pathology at São Paulo University in Brazil. She did work on microplastics in the olfactory bulb of the human brain. She also did work with her colleague, Dr. Michel Cahali. He is head of the sleep medicine and surgery section in the Department of Otolaryngology at the University of São Paulo in Brazil. Together, they set out to examine the presence of microplastics and various inflammatory mediators in the nasal airway in those on PAP therapy. They are here today from Brazil to share the results of their research. Welcome. We are happy to have you here today.
Wow, it's an honor to be here.
Thank you, Seema, for inviting us to be here today. It's an honor.
So, can we start with the New England Journal of Medicine article on microplastics in the carotid artery? Thais, tell me about this one.
Okay, this was the first, let us say, prospective study on microplastics, showing that people with microplastics on their carotid artery, that these patients were submitted to endarterectomy. The people in whom they detected microplastics, that was more or less 1/3 of 300 people, and followed by 34 months. These people had 4 times more chance of having an acute myocardial infarct and stroke or die of any cause. So
Wow.
I think this was the first paper to show, let's say in a more controlled way, adverse effects related to micro and nanoplastics.
I remember that photo. It was alarming to see the specimen from the endarterectomy and how much plastic was in it.
Yeah, sure. Yeah, they did.
So a third.
They did pyrolysis, but they also did electron microscopy to try to detect the particles inside the plaques.
Huh. So that's alarming, just considering how plastic is everywhere. So let's step back a little bit. Tell me about what the sources of microplastic are. Like, where does this come from?
Well, we are surrounded by plastic, so it's very difficult to find a specific source unless you're in occupational setting. But we have plastic everywhere, in our clothes, in our furniture, in our food, in our water, in the air. So plastic enters the body via the digestion, via inhalation, and there's also a dermic route. When you use creams with microplastics, lotions with microplastics, you can absorb microplastics also.
Oh, I hadn't considered that.
Yeah,
Is that common to have microplastic in lotion and cream?
Yes, unfortunately, it's very common. They put a lot, especially if you have these exfoliants, or
No
sometimes
way.
they put plastic to make it more viscous or more smooth. So a lot of cosmetics have plastic. And now, for instance, the European Union has trying to take it out, all these beads, micro beads of plastic of cosmetica. Yeah.
I do remember that. It was in toothpaste and body wash. I remember those little beads.
Yeah. It's plastic. Yeah.
Ugh. So tell me about the 2024 study on the olfactory bulb.
Okay. So when we look at it, at the time there were no other studies in brain. We thought, are the microplastics entering the brain also? Because in all other organs it has been detected by several papers have shown the presence of microplastic in several organs. And then we thought, well, the brain's more difficult to come in. You have the barrier, the hematoencephalic barrier that probably will limit the entry of microplastics. And so then we thought of a olfactory, what they call the olfactory route, that probably microplastics could enter the brain via the olfactory bulbs by inhalation via the olfactory pathway. There are several studies now, what there are studies showing is that the pollution enters the brains in the same way. There are studies showing that you can administer drugs to the brains via this inhalatory route. So we thought, well, maybe this could be an entry place of microplastics in the brains.
That makes sense.
Yeah.
And so you saw plastic and you saw inflammatory mediators in that study. Is that right?
No, in this study, we only saw microplastics. We only saw tiny, very small fragments of particles of microplastics in the brain, in the
olfactory bulb one. Okay.
Yeah.
Okay. So then tell me about this current study. Michel, tell me about that one.
Yeah. So, considering that we are absolutely surrounded by all those microplastics, and that other studies have found those plastics in the carotid artery, and the group from Dr. Mauad found it in the olfactory bulb, we thought, well, what happened in a patient that is using CPAP?
Yeah.
Because we consider that the patient is using the PAP machine for more than 6-7 hours every day, and that machine is pumping air. We figured a lot of microplastics would be pumped inside the respiratory tract of the patient. So we thought, wow, let's study that. Maybe we thought that should be a ton of microplastics in the nasal airway of those patients.
And what did you see?
Well, to our absolute surprise, we compared OSA patients who were using CPAP by more than 5-6 years and patients with OSA that have not initiated CPAP yet, and the amount of microplastics in their nose were absolutely the same. There was no difference between those groups.
Okay.
And that was amazing. We did not expect that. But there is one very important consideration that all those patients, all of them, to be included in the study, they needed to have a super healthy nose. So if the patient if the patient has any sign of nasal inflammation, any nasal allergies, any rhinosinusitis, they would be excluded. So we only included patients with a very healthy nose. And maybe that's an important factor to make, the nose clear those microplastics away. So maybe that's the reason why we didn't find any difference between those groups.
But that's so important, right? I mean, how many patients do we have that have some sort of inflammation or deviation or something wrong with their nose, especially when you consider some of the people with the long face and then narrow nose that have obstructive sleep apnea. So that's a really important consideration. Were you able to control for how old their equipment was?
Well, we didn't really study that, but most of those patients were using CPAP between 5 and 6 years, and it's usually the same equipment because it lasts more than that.
Yeah.
So, but we could not control for the rows, for the mask, age, etc.
That's what I was wondering, because I don't know, do you think it would shed more plastic when it's brand new or more when it's old?
That's a very good question.
Usually it's when it's old.
Oh, okay.
Old plastic suffers erosion, suffers weathering, what we call, and releases more microplastics. Yes.
So how did you have to change how you collected the specimens for this study? Because I imagine you probably couldn't use syringes that had plastic. So how did you do that?
Yeah, that was a problem at the beginnings because we had to use everything glass made, no plastic at all. So glass syringes, glass recipients to store the liquids that we collected, and everything covered in aluminum to avoid any contamination, special setting in the lab with positive air to prevent microplastics to enter in the laboratory setting. It was very troublesome, but very satisfying too.
Wow. So that's nice that you're so thoughtful about every step. Even the air in the lab, I hadn't considered that.
Oh, this is the most difficult in doing microplastic studies is avoiding contamination. It's a critical step because as you have plastics everywhere, if you leave your plaque or something in the air for half an hour, plastic will deposit. Or you'll come from your clothes. Yes, or you'll come from your clothes.
Oh my
your masks. So everything has to be, the apron has to be of cotton. You cannot use anything of plastic.
Huh. So then this is reassuring then, your findings.
Oh, sure. Yes, because we try to be more, the more strict we can, huh? We can,
Yeah.
So then there is a follow-up commentary on your paper, and the authors of the commentary talked about particle size and that maybe there's plastic further down in the airway rather than just in the nasal airway. Tell me about this.
Oh, yes. This is, in fact, it's true. No, we have looked at it before. We looked at the lungs of deceased people to search for microplastics. Because our initial hypothesis before even the nose was that if you are inhaling microplastics, is it coming down? Is it arriving deep in the lungs? So we looked at some years ago already to the lungs of 15 people. 8 had microplastics in the lungs, and there were small particles up to 5 micron. 6 micro, I think the largest was 6. And then we think this is feasible, that such small particles arrive in the lung. And we haven't looked at the nano. The nano are even smaller, and these, of course, with certainty they reach the lungs and probably internalize in the cells.
So is that the next study?
It's very difficult to work with nano. It's very, very difficult because you have to have special devices that we don't have. It's very difficult to work with nanoplastics, yes.
So this is kind of your area, Thais, right? This is similar to where you did examine plastic in the lungs.
Yes, I am a pulmonary pathologist.
Ah, okay.
Yes, and I've been working also with air pollution studies. So that was our interest in look at airborne microplastics.
Okay. So then it's good for the nasal airway, but we think maybe there is some plastic in the lungs.
Oh, yes.
Okay. But we don't know necessarily if there's a difference between people with sleep apnea on CPAP and people with sleep apnea not on CPAP.
We cannot tell. I don't think we can tell about this, yes.
Okay.
Yeah, I believe it's very possible that patients on PAP have some degree of micro or nanoplastics being deposited in their lungs. But I think that only with, at this stage, only with post-mortem studies, we could really establish that.
Well, and so what I've been thinking about as you've been discussing this is it's so hard to control for plastic in the air, right? When you're doing the study that, so they're using CPAP for 6 or 7 or 8 hours, but then they're still breathing the other, the other time, just like all of us. And so I wonder, initially I was thinking it was pressurized air. And so maybe it would push particles further in, but maybe there is just so much plastic everywhere that we're all kind of exposed to it.
Yes, because I think that if you look in the nose of any of us, there will be plastic. We in this study we found 15 types of plastic in the nose of these people. That the people that use CPAP and the people do not use CPAP. So the nose is our big filter, right? So yeah. So I think everybody has plastic in the nose. The question is, how much of this goes to the lungs? How much of this is inhaled to the brain? It goes through the olfactory pathway. I think it's a small percentage. Luckily, but still.
So let's take a short break, and when we come back, we'll talk more about microplastics and PAP therapy. You're listening to Talking Sleep from the American Academy of Sleep Medicine. Welcome back to Talking Sleep. We're talking with Dr. Mauad and Dr. Cahali on their work on microplastics in the nasal airway in PAP users. So what's the next study?
Well, I think regarding the microplastics and PAP users, it would be really important to know if those microplastics are being deposited in the lungs. So perhaps in the future we can study post-mortem patients that were using CPAP during their life and study their lungs and verify the amount of plastics or micro or nanoplastics in their lungs. I believe there is a great possibility that those very tiny particles of plastics are being deposited in the lungs.
So talk to me about, in the paper, you talked about these other mediators that were not plastic. Tell me about that.
Yeah, so we try to correlate the amount of microplastics with the amount of cytokines, because there is some evidence in the literature that at least in patients with nasal inflammation, with nasal allergies or sinusitis, that the amount of plastics correlate with the amount of inflammation, at least in those populations. So we tried to verify if there was such a correlation, and actually there was. Both in PAP users and in non-PAP users, there was a correlation between the amount of cytokines, particularly interleukin 1 and 6, with the total amount of microplastics. So, but they were not symptomatic. There is no observed nasal inflammation on those patients, but at the molecular level, the amount of cytokines was really increased, positively correlated with the amount of plastics deposited inside their nose.
So they didn't have clinical symptoms yet, or at all. Yeah, we don't know.
Yeah, they didn't have. They were using the CPAP for years, and they were super good users of CPAP, and their nose was pretty healthy.
Okay. I mean, I think that's a win. But
good news.
Yeah. So, Thais, tell me a little bit about how plastic is made in the first place. I know it's a petroleum product, but how do you go from that to plastic?
Well, petroleum is extracted from oil, as you told, and then the oil goes for several fractions.
Okay.
One of these fractions goes to these refineries, extract the fractions, and goes to the plastic plants where they manufacture all different types of polymers. To these polymers that, polyethylene, PVC, PET, etc. To these polymers, additives are added because we have thousands of types of plastics, each one with one characteristic, like resistance to flame, color, malleability, and these specific characteristics are given by the additives. What are the additives? Additives are chemicals that they are not very bound to the plastic. They are the ligation with the plastic is not very strong. So when you have the plastic when you heat the plastic, for instance, with food or water, these additives, they leach to the water, for instance. And that is the problem. These additives had been identified more than 16,000 substances.
Wow.
We know only 4,000. More, the other ones, we don't know if there's any harm to health or not. And from these 4,000 substances, more than 1,000 are considered carcinogenic or endocrine disruptors.
So that's why you don't microwave plastic?
Yes. It's because of the additives. And that's, or even put in the washing machine because it heats up there also. It will release lots and lots of microplastics and the additives.
So the dishwasher?
Yes, the dishwasher, yes.
Oh, I didn't know that. Okay.
Yes, I don't put any plastic in the dishwasher.
Okay, that's good to know.
Yes.
Okay.
Yes, yeah.
So you don't heat it in any sort of... So then what about clothing? Like polar fleece? Like that's made out of plastic?
No, it's pure plastic. So these clothes release tons and tons of microplastic in the dishwasher, in the washing machine. The washing machine.
And then it goes into the water,
rivers, and then the sea, and then they evaporate, and then goes to the air, and that's the life cycle of the plastic. Yes, the microplastic.
No way! I didn't know that.
Yeah.
Okay.
Yeah, that's a really very good point to stress because the industry needs to transform the monomers into the polymers, and they need to heat the oil and to add those additives that Dr. Mauad mentioned. And today there's a big discussion regarding who are the villain guys. Are the villains the microplastics, or are the villains the additives, the softeners, the hardeners, the things that are combined with the monomers to make it into polymers, which is what we call plastics. And there's a big part of the chemistry guys that believe that the bad guys are really those additives. So that's why Dr. Theis was so clear in saying that she didn't put plastics into washing machines, etc., because the binding between the additives and the polymers are not that good, so they may release those additives, which probably are the bad guys in the history.
So is that the same as forever chemicals?
Part of the additives are forever chemicals, like bisphenol A, for instance.
Okay.
It's a forever chemical. A forever chemical is a substance that does not degrade, is persistent and accumulative. Yes.
So can I tell you, I remember when I was a kid, there was this commercial, and I'm not sure if it was the same commercial in Brazil, but it was from all of the Coke and Pepsi and, those companies. And there was an indigenous person looking at this beautiful mountains and lake, and he talked about how plastic was ruining his sacred land. And the commercial encouraged all of us to reduce, reuse, and recycle. And so I remember in my brain, this was such a pivotal moment. I embraced the 3 R's, but now looking back, I feel like this was shifting the burden and the responsibility to the consumer rather than the manufacturer, right? Like if we put away our plastic, how does that even begin to make a dent in all the plastic that is being produced? Like, how do we even begin to change this?
Yes, absolutely, absolutely. The industry, the plastic industry, wants to throw all the responsibility to the consumer or the government that does not collect it correct. But the truth is that they don't have. Why do they have to produce a substance that's toxic, right? So, and we know that recycling is absolutely not the solution. In the world, only 9% of the plastic is recycled. The rest is in the nature. And even the word recycling is not correct, because plastic, it does not recycle forever, like glass, for instance.
Okay.
It's not the same plastic. So you use it one or two, it becomes a plastic of less quality that, for instance, cannot be used in food. And then at a certain moment, you have nothing to do anymore, like this black plastic from garbage, or vases to put pot plants.
Yeah.
And then you don't have anything to do with this. So the recyclability of plastic is really a problem. It's also, it's not cheap. It's the resin that is new, a virgin resin, is cheaper. And also we have the problem what they call waste colonialism. So what the rich countries do, put all the plastic containers, sent to Malaysia, Indonesia, or countries where the laws of the waste laws are less strict, and causing a lot of environmental and health problems in the population.
You called it waste colonialism.
Yeah, waste colonialism, yes.
I've never heard that term before.
Yes, waste colonialism. So that's very common. People from that work in plastic waste becoming very sick of it. Yeah.
So then there's two problems, right? One is that the virgin plastic is cheaper.
Yes.
And then the second is that it's not infinite. You can't, every time you recycle it, you change it, and then it becomes unusable.
Yes, it becomes of less quality until a moment it's not used anymore. It's useful anymore, yes.
So then what is our responsibility in the world of sleep medicine? And what I'm thinking about is, how do we reduce our own plastic usage in the sleep lab or the DME? And how do we then encourage manufacturers to adopt safer manufacturing processes?
Yeah. That's a very good question. I don't think I have an answer to that. I believe we need to shift. It requires a mind shift, but not only in the sleep labs. It requires a mind shift in the whole society. So by the time that the people are realize that plastics are not a very good thing for their health, they'll start, charging the government to make these companies shift their type of production, and that's the only way. I don't believe we can do much to improve the way the system is right now.
So given that we will then always be exposed to microplastics, do you have any guidelines for how to reduce our exposure? I mean, is this avoiding certain textiles? How do we reduce our exposure to microplastics?
There's no protocols for it yet. There's no. Yes, the European Union is beginning to think, let's say, in cosmetica, or people are thinking of putting filters in the washing machine to retain the microplastics.
Oh, interesting.
Yes, because clothes are a big source of microplastic in the water. But in fact, there's no regulation. There's no regulation. The regulations are very incipient. And what we can do is, on individual basis, trying to avoid what I say here. It's trying to avoid in our house, in our food especially, try to decrease exposure in the food by not using food in polystyrene, not warming up food in plastic, not washing in the washing machine washing machine in the kitchen, to avoid exposure to microplastic and the additives. And especially what I'm very worried about is children.
Yes.
Because children, they put everything in the mouth. So I always say, don't give plastic toys to children, the clothes you have in your baby and this kind of thing. Or even in pregnant women, people are advocating now the plastic diet in women trying to get pregnant.
Wait,
because of the additives. Yes, because of the additives.
So to avoid plastic.
Yes,
in pregnancy. Yeah, okay.
So don't paint your house because the paint of the wall has plastic. Don't change your furniture. All these kinds of things to avoid exposure to microplastic and the additives.
Oh, so that's big then. Don't paint your house. Don't get new furniture.
Yes. Because then you release a lot of these volatile substances that have they're powerful endocrine disruptors.
Well, and that hit us close to home with the Philips recall of PAP devices a few years ago, because they were concerned about the volatile organic compounds from the foam.
Yes, exactly. Yes.
So I think we're all familiar with that and sort of the concern about that, but now extrapolating to clothing, furniture, dishes, plasticware. I mean, you're right. We're in clothing.
Yeah, they're everywhere. So probably a very good advice would be to avoid heating any plastics. That's very simple and might be useful.
Okay. So then if you are washing your clothes, wash it on cold?
Yeah, I guess it's better.
Or just not buy plastic textiles in the first place. Yeah. Okay, fair. So any final thought? Go ahead.
And I think that for me, the most important thought is to reduce. We have to change our society in a society that's dependent on plastic to reduce, especially the single use. That's a big problem. Single use.
Yeah, that is a big problem.
Single use plastic is 40% what you find in the sea. And it has no sense to use a cup of plastic for 1 second, something that someone had to go to the deep sea to extract oil and then use 1 second and throw away.
What a good way to reframe it. Somebody had to go to the deep sea and get some oil to make that plastic cup for your coffee or your drink. And, maybe we should use it for more than the 5 minutes it takes to drink your drink. Yeah.
Exactly.
Okay.
Yeah.
So any final thoughts for us?
You mentioned the issue with the Respironics devices, and that was in our mind throughout this study. It kind of also triggered the idea to study the presence of microplastics in the nose of those patients. And I believe that after all those, bad news that our community had to face, this is kind of a good news for our patients. It's reassuring.
Yeah, that's fair. Well, thank you both for being here. I really appreciate all of the work that you've done on microplastics and PAP therapy, and it clearly leads to a larger conversation about plastics in healthcare and in our communities in general. So we really appreciate you making the time to share your research and expertise with us.
Thank you so much. You've been such a wonderful host.
And thank you so much. Yes, it was a pleasure to be here.
Listening to Talking Sleep, brought to you by the American Academy of Sleep Medicine. For more podcast episodes, please visit our website at aasm.org. You can also subscribe through your favorite podcast service. And if you enjoyed this episode, please take a moment to leave a rating or review. For more feedback or suggestions, email us at podcast@aasm.org. I hope you'll join us again for more Talking Sleep. Until next time, this is Seema Khosla, encouraging you to sleep well so you can live well.